I chose Jefferson Northeast because I wanted to practice emergency medicine in a community that lets me see, treat, and do it all. Jefferson Northeast offered me the support of a large hospital system, but the autonomy of a strong, procedure-minded program with close attending mentorship.
On behalf of the residents, faculty, and program, welcome to Jefferson Health Northeast Emergency Medicine. I invite you to join us on a little tour to get to know us and to get a glimpse into our everyday life at Jefferson Health Northeast.
My journey at Jefferson Northeast began as a third-year medical student when I was doing my core rotations. And then as a fourth-year medical student, I did audition rotations, and that's when I really fell in love with the program.
As a resident here, you get very comfortable taking care of a lot of very sick and complex patients. I couldn't feel more prepared for my critical care fellowship.
Jefferson Health Northeast is a division of Jefferson Health, one of the largest healthcare providers in the Philadelphia region.
Between our three hospitals, we see about 130,000 visits. Frankfurt campus, down closer to Center City, is our busiest campus. We see about 62,000 visits there. Torresdale, which is where we're standing right now, is our level 2 trauma center. See about 55,000 visits here. And our Bucks campus is about 24,000 visits or more.
Hey guys, Jeff here, one of the EMFM residents, and welcome to our crib. Come check it out.
The Torresdale campus is a level 2 trauma center, primary stroke center, and STEMI receiving center, which are integral parts, I think, to an emergency medicine residency education.
What I like most about the Frankfurt campus is that it's very different than our other two campuses. We deal with a lot of drug addictions, a lot of overdose, a lot of walk-in traumas from that campus. So it's really a melting pot of what's going to happen that day. Every day is different, and it's a very unique patient population that you get to work with.
One of the things I love the most about the Bucks campus is the diversity that it adds to my training experience. For a single coverage campus, you can get a lot of sick patients, which is excellent for someone who wants to end up in a community setting after training.
In addition to our emergency medicine program, we also host an EM-IM and an EM-FM combined training program, as well as a brand new EM-IM critical care track.
The EM-IM program is a 5-year dual training program that provides its residents with the full spectrum of acute care medicine training and experience, from the outpatient setting to the ED, the ICU, and everything in between. The EM-IM program has a focus on the acutely ill, hospitalized, and critical care populations.
One of the most valuable things that I found in the EM-IM training here was the autonomy that we got as residents. Rotating through here for 5 years, I found that I was making a lot of medical decisions myself, obviously with the help of attendings, but it made me feel as I was the one practicing medicine.
I love being able to switch back and forth between the two. I feel like in the ER we really get that sense of how to resuscitate a patient, being really fast, and on the IM side, we're able to follow these patients along as they go, really delve into pathophysiology and finding out more about the patients.
The EMFM program is a 5-year dual training residency program which focuses on both acute and ambulatory medicine and emphasizes importance of continuity of care. This is a unique program that prepares our residents to practice in a variety of outpatient settings, including urgent cares, primary care offices, and emergency departments in rural, urban, or hospital settings in almost any geographic location.
I chose the combined emergency and family medicine program because I love the full spectrum of training that it's going to give me. I'm prepared to see the overlapping chief complaints that are in both the office and the ER, but I'm also prepared to do any procedures and manage critical patients in the ER while focusing on preventative medicine and longitudinal relationships with my patients in the office.
I really enjoy bringing the curriculum to the residents on a weekly basis during our 5 hours of didactics. We begin with Foundations of Emergency Medicine, where we have breakout sessions with the faculty in order to ensure there are no gaps in fundamental knowledge. Make certain that we also touch on the broader spectrum of practicing as an ER doctor with financial and diversity talks.
Conference is a huge part of residency. A lot of people don't think about it whenever they're choosing a program, but it's a dedicated amount of learning every week for all years of residency. So it should be something that you benefit from and get a lot of learning from.
One of the really unique aspects of the JEP Northeast curriculum is that there are 6 weeks of dedicated ultrasound education built into the curriculum. So you get 4 weeks intern year learning all of the basics of emergency ultrasound, all of the ACGME requirements, and then you get 2 additional weeks as a senior resident where you really hone your ultrasound skills. And we've been able to tailor that rotation to whatever the residents' career aspirations are.
There's 2 things that I love about training in Philadelphia. The first of which is the patient population. Being in a major city, I feel like we get a lot of really sick patients. We work in an urban community. We also work in a suburban community. So we see a lot of different variety as far as pathology goes, different comorbidities. So just the variety of different illnesses that are out there. And the second thing that I love is Philadelphia has a very strong EM community.
I came from New York, but I think Philly is amazing and it's grown on me a ton. The food here is amazing. The people are super nice.
So some of the things that I love most about training in Philadelphia is access to both urban and rural areas. You get to reap the benefits of living in a big city, but then you also have suburban and rural areas where you can go out and hike with your family or your pets. Another thing that I love about Philadelphia is that it's a cultural mixing pot. So not only do you get to live and play in a great area, but you also get to learn from a diverse set of cultures and people. The wellness program here is something I'm very, very heavily involved in and I love. It's something we've made into a curriculum over the past few years. We understand here that everyone's experience through residency is a little bit different, so we have resources that are set up to help you get through it and maintain your well-being while getting through residency.
I picked a 4-year program because I think it gives you extra clinical experience. We get to do extra time in the ICU, extra time on trauma, and I think that really helps you become more confident as a clinician in the emergency department. And on top of that, the extra year provides an additional sense of autonomy to become more comfortable with being on your own rather than under the guise of someone else.
My favorite thing about our program is the people, and I know everyone says that everywhere, but our people, you walk in and you see their smiling faces and familiar faces throughout the hospital, and it just makes you happy to be at work.
The best thing about residency program here is that everyone makes you feel like you're really wanted here and part of the family.
I have met a bunch of my best friends here. The people are amazing and we always have each other's backs.
I'd say the #1 absolute favorite thing about this program is the people in it.
The best thing about this place is the people.
I think it has to be the people I've met. Honestly, some of my best friends I've met through residency here.
I'm so thankful to have done my residency at Jefferson Northeast. I couldn't have felt more prepared and more supported in this environment.
If you get a chance to come here to rotate with us, you will see what everybody's been talking about, and we guarantee that once you come and you experience us, you will not leave. We have that way of sucking you in.